It started really young for me. I think when I was first grade, believe it or not, I had a choice of two career fields, and that's either to be a pilot or to be a physician. And I leaned towards being a physician because I really was interested in the human body and how it healed. Matter of fact, I remember going to my pediatrician and looking at my growth chart and saying, oh my God, look at how much I've grown, and seeing that I was always in the 95th percentile or higher. When it came to that, I was always fascinated by it. The decision for not being a pilot was kind of made for me when I did my Air Force physical way back when in high school, when I wanted to go to the academy, and I didn't have 20/20 vision, it was 20/25 vision. And so in that lane I said, okay, it looks like it's been decided for me. And then of course the Air Force decided that you can have corrective vision and still fly, but that's when I became a flight surgeon instead, after I graduated from medical school. So it started pretty early for me, and then I still was able to combine at least my career paths and trying to learn how to fly as well as trying to be a good physician. When it came to at least deciding to be a cardiologist, in a brief description, I was just fascinated by the technology that cardiology brings forth. Rotating through a variety of subspecialties in medicine, I knew I liked doing things with my hands. So, an invasive type of career specialty always intrigued me, but then the physiology of the heart and how it functions and how it integrates all body systems was one that fascinated me and one that I really wanted to pursue. The best part of my job is making people feel well. There are very few instances in cardiology that we don't have evidence-based medicine, or for lack of a better term, protocols, where we can actually institute time and time again proven methods in making people feel well. Now, it's not 100%. There's nothing ever 100% in life, but that's one of the most fulfilling aspects of the career field that I find, is that at least using the armamentarium of technology, techniques, medications, overall we can improve clinical outlooks for patients, even in the most desperate of situations. The area that I'm the most passionate about, I would say, would be sports physiology. That's something that I've always had an interest in. I've always been somewhat athletic at certain career fields in my life. And so looking at sports physiology and the interaction with high-performance athletes when it comes to the heart has always been a particular interest of mine. The most common question that I have, why me? I've been healthy all my life. How all of a sudden, out of the blue, do I have this particular heart problem? And it can range from a variety of things. Sure, we see atrial fibrillation a lot. It happens, one of the most common heart rhythm abnormalities. Sure, if you look at the studies, we see a lot of congestive heart failure. Also, a third thing that we see a lot of, coronary artery disease. And I get this question almost every day. Why me? Why do I have to take these medications or prescriptions? And my job is to at least reassure patients that at least it is a treatable disease or manageable disease. As far as my care philosophy as a physician, what I like to do is, and I smile when I say this, treat patients with the least amount of medications possible. Sure, we have a lot of things that are time and time proven, again, as far as what pills are great for what clinical condition. My goal as a clinician is, one, trying to make sure that you don't get the disease or any further complications of the disease, and two, trying to minimize at least the potential interactions of many medications together. And so my care philosophy in working with the patient is customizing your treatment plan for you. And that's where in cardiology we're even moving forward as far as technology is going, looking at genetic testing, specifically moving forward in tapering and adjusting particular pharmacies, meaning medications, for your genetic profile. And that's something that I find is going to be intriguing over the next 20 years.